Hi, everyone. My name is Kristen Smith. I'm currently a PA working at the University of Rochester Medical Center, and I am also the APP manager of our in the urology department at the University of Rochester. I'm glad to be here today to give you this presentation. My talk is going to be on strategies to effectively integrate and optimize advanced practice providers, otherwise known as APPs, in the urology care team. I have no disclosures. So to understand how to fully utilize APPs in urologic practice, we first have to recognize and acknowledge the challenges that face urologists currently. There's obviously many, but we have outlined a few here which are integral to the growth and understanding of any department. So to start, current challenges facing urologists. The first is increased patient volume. Obviously, we have an aging population, and as people live longer, they're more likely to develop age-related urologic conditions such as BPH, incontinence, kidney stones, urologic cancers, etc. With that rising incidence of urologic conditions, there is a higher volume of patients that need to be seen. Also contributing to the increase in patient volume is the increased awareness and screening of urological conditions and the importance of regular screening. So this increase in patient volume has led to time constraints. Urologists only have a limited time to spend with patients due to the patient volumes as well as the administrative tasks that they now have to do, including working with e-record, more extensive documentation for billing purposes. And this increase in patient volume has also led them to have more surgical responsibilities. So now they have less time in the office to actually see patients. Coupled with this is the increased patient complexity. Again, due to this aging population, patients have more comorbidities, unhealthy lifestyle practices, including poor diet, lack of exercise, and smoking, also contribute to a rise in urologic issues. And it also makes surgeries more complicated. So due to all these factors, we now have increased patient volume, and we actually have a shortage of urologists. And this is really twofold. There's only so many urology residents, so there's only so many urologists coming out of residency, and it's not adding up to the increased patient volume seen in practices. And then all of the increases of patients, the admin responsibilities, the increased surgical responsibility is resulting in early retirement of current urologists. It's just becoming too much. So physicians have started to think about retiring early or even just scaling back their practice to try to achieve some form of balance in their lives. So with these challenges, we can easily identify the necessity to expand our workforce in response to our patient needs, prompting the development of a strategic plan to effectively scale our operations and accommodate our growth. So how can any department achieve this and be successful? Just for a little history, our department has grown from 10 APPs to 26 APPs in the past 7 years, pretty successfully. We have 9 locations. We cover both ambulatory and inpatient, including consults and OR support, as well as pediatrics. For the purpose of this presentation, I am going to continue to focus on just the adult ambulatory and walk you through how we were successful at achieving this growth. So our routes to expansion, our first step was to identify the need by analyzing current utilization of schedules. We looked at wait times for new patient visits, how many follow-up appointments we had. We looked at our referral queues to understand the need and as everyone knows, urology is involves both medical and surgical management of patients. So in many instances, we're following patients long term, and because of this, our schedules 3 months, 6 months, 1 year out, they're already full. So we wanted to look at ways to be able to offload those follow-ups to our APPs to allow the attendings to have more ability to see some of these new patient surgical consults that they needed to see. So step 2, developing a business plan to support growth, including financial projections, resource allocation, and infrastructure requirements, and then define the goals and objectives for expansion, such as reducing wait times and improving patient satisfaction. Once we were able to identify what our need was in each instant, we then knew we needed to have an interview process involving multiple members of the APP team and MDs to ensure finding a candidate that embodied the value of our current team. And once we hired these APPs, we wanted to focus on key components for long-term success and retainment. So the next slide is going to focus on key components to success and retention. Listed below are the areas that we found to be integral to our long-term plan. And I'll go into each of these in more detail. So we'll start with our onboarding process. So we have a pretty robust onboarding onboarding program in our department. On average, it's about a 6-month period of structured orientation. Obviously, that can vary based on the candidate that we bring in and the experience that they have coming into the position. Even if we've identified what area that an APP is going to go into, we still want them to have a broad knowledge of urologic diseases. So we rotate them approximately every 2 weeks with different subspecialties, including inpatient time, getting them into the operating room to see different types of cases, both robotic and lesser invasive procedures. Our training is primarily with our APP team, but we work pretty close with our attending physicians. So physicians are also utilized in the training as well. We assign weekly reading to each of our new APPs. Everyone, when they start, we get them a copy of the Pocket Urology Guide, and that kind of becomes their one of their biggest resources going through that they can go back to and look things up. We try to assign the reading based on what subspecialty they're going to be in, and then really kind of focus on what they've learned in that. We've also make sure that billing and compliance education is part of their onboarding experience. Many of our APPs, especially new grads, just weren't given much education on billing throughout school. So we have our billing and compliance officer meet with them during the orientation process pretty early on. And then once they're up and running, they also will be the billing and compliance officer will meet with them. They'll go through their charts. They'll audit their charts and billing about 3 months in, just to make sure that they are on course where they need to be. Once our APPs are independent, again, that's anywhere from 3 to 6 months, we will start them with a reduced schedule and then slowly ramp them up to their expected template within that month. Our APPs, our templates are set somewhere around 16 to 18 patients, depending on the subspecialty. And then we also have them, that allows us to have some room to add patients as well to their schedule. Even when they're off orientation, they're continued to be supported both by physicians and APPs. So regardless of where they are, there's clearly a large learning curve in urology. So they always know that they have support and backup by somebody on our team. So next, we're going to focus on the collaborative care model. Successful utilization of APPs really all starts with the emphasis on the collaborative care model and looking at all members of the care team. Collaborative care model can have different meetings. And first and foremost, we're going to look at that collaborative care model with the physicians. So by working in a collaborative setting, it really allows the physician to focus their time on complex cases, surgical procedures, research, and teaching, while the APPs can handle routine follow-ups, post-ops, patient education, and preventive care. It really maximizes the productivity of both urologists and APPs. So our APPs work very closely with our physicians, nurses, other members of our care team to deliver comprehensive care. It also allows increased access to both MDs and APPs, and it helps ensure continuity of care with our patients. So the way we have it is currently we have a mix. So we have independent clinics as APPs, where we have our own patient panel. We see a mix of new patients, follow-up patients, post-op patients. And then we have some of our APPs who also participate in shared clinics. This is mostly with our more complex subspecialties, but in this scenario, our attendings and APPs work off of one schedule. The schedule is built to accommodate 2 providers, so it will be double booked throughout the day. So we are seeing the same number of patients that we would be seeing if we each had our own independent schedule. But the benefits of working off the same schedule is it allows increased new patient access for surgical discussions, cancer discussions with our attending physicians. We all know there's certain patients that need to see the physician, and their time in the office is limited. So we're really trying to maximize the number of patients they're able to see in clinic, so that we can get this patient's care started and then set up their future plan. It also allows APPs to be integrated into the care team from the beginning. So patients are exposed to the collaboration. They understand the role of the APP in the clinic, and then they feel more comfortable following up with them as in their future care. Another benefit of collaborative care model is that it allows APPs to continue learning and growing skills. Whenever we can, we try to make sure that our APPs are in a parallel clinic. So if the attending is in clinic, then the APPs are also in clinic with their own schedule, but that allows them to be able to ask questions in real time, review scans, and be able to feel confident going into the patient visit, knowing what questions are setting up their care plan. It also allows, the collaborative care model, just going back to that, it also is important to help foster growth and relationships between the attendings and APPs. So just going back to being able to have them as a resource and learning how to work together, it also allows you to be able to understand, the physician that you're working with and how they manage their patients. So it ultimately just very important to be able to work together and foster that relationship, both for APPs, physicians, and for patients. And then the other important piece of this is the care team support. So this is also part of the collaborative care model, and it's not only support from the physicians, but the support of the entire care team. So we have taken a long time to recognize our APPs as providers and ensure that they have the same support as our physician colleagues do. So that means the same amount of space, the same amount of nursing support, the same amount of admin support. We really worked hard to emphasize delineating the roles of the administrative staff, the nursing staff, and we broke down what each job can do within their scope, so we can be sure that we're utilizing the appropriate team member to do the task. And it allows us to free up our APPs to see patients, which is ultimately the goal. Not just to see patients, but to work at a provider level. So when we first started this, and I'm actually doing this project with the entire ambulatory department at the medical center, not just urology, but we really identified that there's a lot of APPs that are many times doing tasks that someone else on the care team can do, and it takes them away from being able to see patients or help support patients, which downstream effect leads to access issues and long wait times. So um, we we took a step back to see what people are actually doing and really looked at this as a care team redesign to see how we could redistribute the workload to better utilize each team member within their scope. Again, as you can imagine, it's pretty important because it does free up the provider, both the MD and the APP, to be able to see patients and focus their time on provider level care. We also utilize pools for in-basket calls and messages. We have, as you all probably do too, about 400 calls a day, my chart messages. Patients have more access to providers than they ever had. So need to make sure that we have appropriate routing of messages to the appropriate team member. For our situation, all of our messages will go to either our admin team or our nursing team first for triage, and then only on to providers if it needs a provider level discussion. Is this a perfect system? No, we actually work on this pretty often, trying to make sure we have the right workflows in place. But it has significantly improved the workload and the balance of our APPs. And it's also made our admin staff and our nursing staff feel like more valued and more a part of a team because everybody's contributing to the same goal. And it's actually all the way around helped us to retain members of the team at all levels. So moving on to other important things that allow us to integrate our APPs is continuing education. That's important just to all providers. In our department, we have one of our APPs has started APP-specific education sessions for our team. About once a month, we have either attending physicians from within our department lecture on a topic. We've also brought in outside presenters from infectious disease, pelvic floor physical therapy, and we have our own APPs present on their specific subspecialties. It's been really well received by our team. Nursing staff will also sit in on the education sessions. We typically do it during lunch, and we send a Zoom link out. When we also get continuing education credit for this. So it's been, like I said, really well received and very important to help us continue to be well-rounded. We encourage grand round attendance, encourage national conference attendance. We also continually educate on updating billing and compliance issues. So anytime there's changes with Medicare billing or new billing codes, such as this year it was the G2211 code. So we make sure to get our billing and compliance officer in front of our faculty group and APP group to explain those changes so we all can understand how to bill and making sure we continue to be compliant. And then also we just have ongoing mentorship. So from orientation and continued throughout, there's always that invested interest from our physicians and our fellow APPs to continue to mentor each other and make each other stronger. So career development is another important aspect, especially when you're talking about retention of APPs. So we went through this whole process of trying to find the right candidate, really making sure they're trained well and have the support, and we really want to be able to retain them. And part of that really is dependent on career development because people want to feel as though they can continue to grow in the role that they're in. So the medical center has us do yearly evaluations, which can be cumbersome or seem cumbersome to some, but they really do help in evaluating to highlight each APP's achievements over the past year, give them to take time to reflect on their year and recognize areas that they may need continued support, look at their goals from the year prior, see if they were able to achieve those goals. And if they weren't, why they weren't. Sometimes that's because their goals changed or just other things came up. So just trying to identify that. And then we use that time to really think of thoughtful goals for the upcoming year, to give them an idea of where they want to be and have them think about where do you want to be in a year? What are things that interest you and areas where we think that they can grow. We also are try to be very cognizant of providing opportunities for advancement and professional development within our organization. So there's different leadership opportunities that come up that allow them to still continue in urology, but then be part of the bigger organization and really grow into different leadership roles, different education roles. So we really support that within our group. So what are all the outcomes of all of these initiatives that we've taken over the past several years? So we were successful, as I said before, about by expanding our APP workforce, and we experienced that significant improvements in operational efficiency, and that APPs really are playing a crucial role in streamlining these workflows, reducing wait times, optimizing resource utilization. We have seen a reduction in our wait times, and it really does fluctuate, but a reduction in our wait times by about 6 to 8 weeks in some cases, and really that we're constantly looking at that because as our wait times get longer and our providers are all filling to capacity, that's when we really need to start this process all over again and look at when we need to add more staff. And now more than ever, as there's a shortage of urologists. And if urologists are leaving, it's really not easy to fill that gap. So we are using APPs more so than we ever have. Because we have such a large group now, it has allowed us to really be able to subspecialize and develop this expertise within these specific areas. So we have oncology teams, reconstructive surgery teams, kidney stone team, a general urology team, a men's health team. And these teams are supported by APPs, physicians, nursing. And while everybody has general knowledge, it really helps them to really understand one aspect of urology and also be a resource to other members of the team to be able to answer questions. Ultimately, by prioritizing these initiatives, it's really led us to create an environment where APPs feel valued, supported, and motivated to continue their careers. So we have a lot of APPs in our group, like I said, and our retention is really well. We really don't lose too many APPs to other departments or other jobs. And I think a lot of that is just based on the culture that we built. We're busy. Everybody's busy and working hard, but we're just trying to balance all the aspects of their career. So with that, that's the end of my presentation. Just wanted to thank you all again for giving me the time to present.